Hi, I'm Dr. David Hill, and today we're going to talk about how do I bottle feed a baby who has an ear infection? Well, you do want to make sure, first of all, whenever you're bottle feeding a baby, that he or she is not lying on his or her back during the feeds, because ideally we don't want them to get an ear infection in the first place. There's some thought that babies who lie straight back while they're feeding get some irritation of the airway up there that can actually contribute to developing ear infections. So step one, don't lie your baby on his or her back to feed so that they don't get an ear infection in the first place. Now, let's say your baby already has an ear infection. He or she's bottle feeding. What are you going to do now? They're fussy. They don't want to sit still. Well, there's some things you can do for the discomfort of the ear infection, certainly. The most obvious are ibuprofen, acetaminophen. Ibuprofen's what's in Motrin and Advil. Acetaminophen is in Tylenol. These are pretty darn good pain relievers. Now, in the old days, we used to tell people for their baby's fevers, oh, alternate, do one, and then every 4 hours do the other one, and keep track. We don't say that anymore. It doesn't work any better than just doing one, and it raises your risk for accidentally overdosing your child with a pain reliever, and that can be very dangerous. So pick one that seems to work well and just stick with it at every 6 to 8 hours, and you should be doing okay. Now, if that's not holding your baby for pain, your doctor can prescribe, or your baby's doctor can prescribe drops for pain. These are generally antipyrine benzocaine drops. You'll hear them referred to as abiotic, or Orelgan is a brand name of this product. These drops numb the eardrum that's hurting from being stretched out and inflamed by the infection. And those drops can really buy you some serious relief. Now, you want to make sure that your baby is staying hydrated. If you have an infant who's 6 months or older, you might want to give them a little bit of water, Pedialyte, or juice if they don't seem to be doing very well with formula or express breast milk. But make sure that he or she is getting something to drink, because you don't want to be getting in the trouble of dehydration. So, talking about how to bottle feed a baby who has an ear infection, I'm Dr. David Hill.